CPT JJ-CPV Introduction, page 12, part 5.
Introduction. Changes to the CPT code set are meant to be applied prospectively to happen in the future from the effective date.
Okay, and we got a picture there just so you can remember that they are supposed to be happening in the future, right? So let's keep going. The main body of the category 1 section, which is the one that we're studying, remember this category 2 and category 3 for these codes. The category 1 of this section is the one we're going to study for procedures, is listed in 6 sections. So there are 6 sections for this category 1, right? Next line, next page. Okay, can you read that?
Yes. Section 1.
Section 1, I'm sorry, it's
Evaluation and Management, EM.
E/M, right?
Yes.
Its abbreviation is E/M, and it's called Evaluation and Management. And what it is just to classify the kind of visit that the patient has to the doctor's office. What kind of history was done? What kind of physical examination it was done? What was the medical decision? And how much time did the doctor spend with the patient? If it's a new patient, if it's an old patient, it's just to classify what kind of visit it is, right? And now we're going to read all in this table here. Allow me to show. In this table here, it's all like a synopsis, like a summary of all the possibilities, right? So this is the code CPT code, right? To code in CPT code. And can you read this?
Yes. History.
History here means
Medical history.
medical history, right? Now the PF means
Problem-focused history.
that's one of the categories for history. Problem-focused history. That EPF means
Extended problem-focused history.
that's another category. And then
Detailed history.
DET means detailed history, and COMP means
Comprehensive history.
comprehensive history. That's the first column. These are all the possibilities for history. Now we're going to go to exam. Exam means physical examination. And the initials are the same as in history. So it's the same. It's a problem-focused examination, extended problem-focused examination, detailed examination, and comprehensive examination, right? The next column is MDM. What's MDM?
MDM is medical decision making.
Right. And SF is?
Straightforward.
It's a straightforward medical decision making, right? And then we have low, right?
Yes.
Which is?
Low complexity medical decision making.
Medical decision making. And then we have mod for?
Moderate complexity.
Medical decision making. And high we have?
High complexity.
Medical decision making, right? Now the last column is for the time, which is?
Time spent in the visit.
Time is spent in the visit. The time that the patient is in the doctor's office, right? And if, for instance, if he says 10 here, then that means?
10 minutes.
10 minutes, okay? Okay, so that's our theory for today. Now we're going to do the problem. Ready, set, go. Okay, the problem is CPT JJ-RVA, page 254, exercise 51, and this is a level 1 exercise, and it reads like this.
Surgery, cardiovascular system. Patient returns to the operating room following open heart bypass for exploration of blood vessel to control postoperative bleeding in the chest.
That's right. It's the surgery section of the CPT code in the cardiovascular system. The patient returns to the operating room following open heart bypass for exploration of blood vessel to control post-operative bleeding in the chest. That's the problem, and you have to give us the CPT code or the code for the procedure for this procedure, right? So we're going to count to 3 so you can pause the video and then give us the code, okay? 1, 2, 3. All right, the answer is 35820, okay? 35820. If you got that answer, congratulations. You can just stop here and go to the next video. If you didn't get it, let's give you a few tips. Okay, the tip number 1 is
Start with exploration.
Why? Because it says
Exploration of blood vessel.
a blood vessel, right? And the second tip is
Ignore the diagnosis. Postoperative bleeding test.
Postoperative bleeding test is the reason why the patient is in the hospital, right? We don't code diagnosis with CPT. We just code that. Remember that we're just coding the
procedure.
That procedure, right? Okay, so you already have the tips, right? And you know the answer. The answer is 35820. But now we're going to pause the video so you can give us the path to the answer, how we got to the answer, okay? So 1, 2, 3. All right, this is the summary of the whole problem. This is a surgery section of the CPT book. It's a cardiovascular system. The patient returns to the operating room following open heart bypass for exploration of blood vessel to control post-operative bleeding in the chest. There's only one code, and the code 1 through the index is found like this.
First you go to index.
Right.
Then you go to exploration.
Right, you start with the exploration, right? And then
you go to blood vessel.
Blood vessel. And then
you go to chest.
Chest. And what code do you get?
35820.
Right. And now we're going to check this code in the tabular. So the code 1 through the tabular is found like this.
First you go to tabular.
Go to tabular.
Then you go to 35820.
You start with the code that you found in the index. And what does it say there?
Exploration for post-operative hemorrhage. Chest.
It says a lot of stuff more, but then this is chest, which is a word that we need. So that's why there's an equal sign at the end, right? Mm-hmm. And the answer is 35820. Okay? Thanks for watching, and don't forget to visit our website and
you can subscribe to us on YouTube by clicking here for our new medical coding videos.
Right, and let me point out that the clicking is right here. You have to click here, and then you'll subscribe, and then you get our videos, right?
We make about 3 videos every day. ICD-10s, CPTs, all that is needed to pass the medical coding certification exams.
Okay, thank you then. Thank you for watching, and then we'll see you tomorrow. Bye-bye.